And then you have the lateral rotators of the hip. So then you have the iliopsoas. And what's the action of the iliopsoas? What kind of rotation? If it attaches here to the lesser trochanter, it's going to do this, right? So what kind of rotation is that? Which way does the front of the thigh move? External rotation. So then there's not really going to be up on the test, but you do have the femoral triangle here, which is from the sartorius and the inguinal ligament and the adductor longus. So there's different things you find in there, the femoral artery, vein, femoral nerve, and lymph nodes. And then the sciatic nerve. It's not really the thing on the list for palpation, but you know that it goes between the greater trochanter and the ischial tuberosity. There's a whole path of the sciatic nerve that will get covered later in other classes. So then we have the leg and the foot. We'll go through this a few minutes and then we'll have time to palpate a little bit. So what's this tendon right here? Right, and then this one? So I think, was that the one we were talking about? Where one of the point landmarks that says middle of the extensor digitorum. Yeah. So that's, you know, if this was the foot, you got toes 2 and 3, and then 4 and 5, so in between the middle of it. And then we've done this before where you palpate the different landmarks on the knee, the patella, femoral condyles, epicondyles, tibial plateau or tibial condyles, head of the fibula, tibial tuberosity. So then here, you can see here's where those muscles come into the sensory area. You have the sartorius, tendinosus, and bursilis. And then there's that adductor tubercle. And then we went over last time the different landmarks on the feet that you palpate, the head of the fib. Or I mean the face, I'm sorry, this would be the head, this would be the face. Cuboid, calcaneus. And then what's the insertion of the tibialis anterior? I hear mumbling, but I don't hear.
What was the question?
The insertion of the tibialis anterior. Okay, it's on the medial side or the lateral side? It's on the medial side. Does it go all the way to the big toe? No. Does it go to the metatarsal? Yeah. How about right about there? And then what's the bone that's next to it? Right. So it's going to go right about there. So again, here's some of the landmarks. We talked about the posterior border of the tibia. Is there a lot of important points along there? Yeah. You need to know those points? Not yet. Okay. So don't worry about it. But then when you talk about the medial malleolus, you can get a little bit more specific then. If we talk, you know, we say, okay, where's the medial malleolus? Yeah, it's right here. But what if we say the anterior, inferior, the depression anterior and inferior to the medial malleolus? Then you're going to be talking about here. So if you're talking about a line drawn between the posterior border of the medial malleolus and the inferior border of the medial malleolus, posterior to that. So it gets more details when you start having to talk about points. But at this point, all you need to know is, okay, here's the medial malleolus. But keep in mind that later you have to differentiate anterior to it. Remember, there's all those anatomical terms again, right? So you need to know anterior, superior, inferior, posterior, lateral, medial. So then there's on the lateral side, you have up here it says in the depression anterior and inferior to the lateral malleolus. So that would be more specifically right there. And then here, what's that ligament right there? Is this the medial side or lateral side? Medial. So what's the ligament on the medial side? The delta. Right? Yeah, we didn't get into, each have individual names, we didn't get into details on that. But like here on this point, it says, below the prominence of the medial malleolus in the groove formed by two ligamentous bundles. Okay. And then what's this tendon again? Tibialis anterior. Okay, so there's the base of the fifth metatarsal. There's the calcaneus. So you can see a lot of these things are going to come up when you need to do point location. So here, what tendon is this right here? Right. And then what's this one? Sensor hallucis. And then how about so then we've gone over these things here, different palpation landmarks on the feet. Medial malleolus, lateral malleolus. And then you get into those actual grooves right here on the malleolus. Okay, so what's gonna pass along that groove right there? Which tendons? What's that? Okay, this is going to be more under here. What loops under and comes under the bottom of the foot?
Yes, let's see.
Yeah, tibialis posterior, flexor hallucis longus, flexor digitorum longus. And then what's going to come around this side here? Yeah, so what are the muscles of the lateral compartment of the foot? Or the leg, I mean? So, Peroneus or fibularis, longus and brevis.
What about the tertius? That goes around the malleolus too.
That, it goes anterior to it. It's a dorsiflexor and the other peronei are plantar.
Can you clarify what is pronation and supination in the ankle?
Yeah.
That's,
What pronation is a combination of dorsiflexion, abduction, and eversion. So this is pronation like this. Okay. This is supination. Plantar flexion, adduction, inversion. Okay. So when in gait, when you're walking, you start out, you land on your foot in supination, then it goes into pronation. Because we talked before about the foot has to be rigid, but it also has to be flexible. So it's rigid when it's in supination. Then, if you're on an irregular surface, your foot pronates, so it becomes more loose. Then it has to supinate again to toe off. Right? So normal gaits like this, pronate, and then supinate. Okay, and then we did this before where we have the medial malleolus going over to the navicular, and then you have the talus underneath. And then actually pronation and supination occurs at this joint under here. So what would you call that joint? If you're talking about what's a name, a word that you use when something's underneath something else? Yeah, sub. And then what's this bone right here? Talus. So you have the subtalar joint, which is between the talus and the calcaneus, and that's where pronation and supination happens. And what joint does plantar flexion, dorsiflexion occur? Between what bones? Between the tibia and the fibula and the talus. It's called the ankle mortise. So it would be right here, then between the tibia, the fibula, and the talus. It's going more like this, whereas subtalar